What if I told you your teeth are not the real problem, your gums are? And most people do not even realize something is wrong until it is almost too late. Today we are talking about the shocking truth behind gum recession and why seeing a dentist for gum recession could literally save your smile. Dr. Esma, is it true that bleeding gums and a little sensitivity are early warning signs people ignore?
Absolutely, Rasim. Gum recession often starts quietly. A little cold sensitivity, gums looking slightly longer, maybe some bleeding while brushing. Many patients wait months before visiting a dentist for gum recession, and by then the damage can be deeper than they think. The earlier we act, the more natural tooth structure we can protect.
So here is the big question. Can gum recession actually be reversed, or are people stuck once it starts? Stay with us, because what Dr. Esma is about to reveal might completely change how you look at your next dental visit. Let me paint a picture, Dr. Esma. Someone brushes a little harder because they want whiter teeth. They notice their teeth look longer in selfies. Cold water suddenly feels sharp, but they shrug it off. That sounds familiar, right?
Very familiar, Rasim. Overbrushing, smoking, grinding teeth at night. Even untreated gum inflammation can slowly push the gums downward. Patients often say, I thought it was normal aging, but when they finally visit a dentist for gum recession, we sometimes find exposed roots, higher cavity risk, and even early bone loss.
And that is the scary part. It creeps in quietly. No dramatic pain, just subtle changes. By the time someone feels real discomfort, the situation may already be advanced. So how do people know when it is just sensitivity and when they urgently need a dentist for gum recession? Okay, Dr. Esma, let us be real. Some people might think it is just gums. Why is this such a big deal? I mean, if the teeth are still there, what is the worst that can happen?
That is exactly the misconception, Rasim. When gums recede, the protective layer over the roots disappears. Roots are softer than enamel, so they decay faster. I have seen patients who ignored recession and ended up needing root canals or even extractions. A dentist for gum recession does not just improve appearance, we protect stability. Once supporting bone is affected, teeth can loosen. That changes everything.
So it is not cosmetic vanity, it is structural survival. That tiny gap near the gum line could be the first domino. And if someone waits too long, the fix becomes more complex, right? Dr. Esma, give us some context. Is gum recession actually common, or are we talking about rare cases that just sound dramatic?
It is far more common than people think, Rasim. Studies show that a significant percentage of adults over 30 have some level of gum recession. I recently treated a patient in his early 40s who felt no pain at all. He only came in because his teeth looked longer in photos. When we examined him, we found multiple areas where the roots were exposed. Visiting a dentist for gum recession at that stage allowed us to stop further damage before it affected his bite and confidence.
That is eye-opening. So someone can feel perfectly fine, smile every day, and still have silent changes happening under the surface. That makes early evaluation sound less optional and more essential. Dr. Esma, let us zoom in on the science for a second. What is actually happening under the gum line when recession begins? I think people imagine gums just shrinking, but I know it is more complex than that.
You are right, Rasim. Gum recession is not just surface movement. It often begins with inflammation triggered by plaque bacteria. The immune response can gradually break down connective tissue and even the bone that supports the tooth. When someone visits a dentist for gum recession, we measure pocket depths, evaluate bone levels, and assess tissue thickness. Thin gum biotypes are more vulnerable, especially if combined with aggressive brushing or grinding.
So it is a chain reaction. Bacteria, inflammation, tissue loss, then structural risk. That makes it less about cosmetics and more about biology. No wonder early intervention changes the outcome so dramatically. Alright, Dr. Esma, let us get practical. If someone suspects gum recession today, what exactly should they do first? Walk us through it step by step so no one feels overwhelmed.
First, book an evaluation with a dentist for gum recession. We assess gum levels, take measurements, and check for bone support. Second, control the cause. That may mean professional deep cleaning, improving brushing technique, or managing grinding with a night guard. Third, if tissue loss is advanced, we discuss regenerative options like gum grafting to cover exposed roots and strengthen protection.
So it is not guesswork. It is evaluation, cost control, then targeted treatment. That sounds manageable when broken down like that. And I love that the earlier someone sees a dentist for gum recession, the simpler the solution can be. Before we wrap up, Dr. Esma, let us talk do and do not. Because I know someone watching right now is thinking, I will just brush harder and fix it myself. That is probably not the move, right?
Definitely not, Rasim. Do switch to a soft bristle brush and gentle circular motions. Do floss carefully and consistently. Do schedule regular periodontal checkups, but do not ignore bleeding. Do not use whitening strips excessively on exposed roots. And please do not delay seeing a dentist for gum recession if you notice changes. Early action prevents complex procedures later.
I like that. Gentle, consistent care over aggressive quick fixes. It sounds simple, but small habits either protect your gums or slowly push them back. That is a powerful reminder.